Okay, I'm Dr. Corey Campbell with the Motion Palpation Institute. We're going to talk about skill development and things that you can do to help increase your skill level. So, a lot of what's talked about in the FTCA and the CSA is, how to be a super performer, how to be a highly skilled practitioner. And honestly, guys, there's no tricks to it. There's no hacks. There's no way to get around this other than just practice. And so, part of what makes skill development easy is to have something that's reproducible and routine. And so what I'm going to take you through, for those of you that have been practicing for a number of years, and you probably already have your flow down. For those of you that are early in practice, this is something that you could start to do. I did this for the better part of 12 to 13 years of my practice. Now I take a few shortcuts because I feel like I can, but I still kind of fall back into this basic routine with a few modifications here and there. So this is a palpation screen that's going to encompass 2 or 3 different palpations that kind of go through all the transitional areas, the areas that are hard to palpate. And so the biggest knock on palpations is it's not reliable. Part of the problem is that we don't have a system or a systematic way to approach palpation. And so if you want your skills as a palpator or as an adjuster to go up, then you need to have some sort of routine that's reproducible. And I think this is a good place to start. And I think this is where your skill development, especially as an early practitioner, if you start doing this on every single person that walks in the building, make it a habit, make it a routine, make it consistent with everybody that walks in and sits down, then your palpation skills are just going to exponentially get better. And I think that's a huge part of skill development. I think that's what's going to set you apart in the chiropractic world. Here where we're at, Ryan can tell you on his way here to work, he went past 4 or 5 different chiropractors. And every one of the chiropractors that he goes by probably doesn't do the same thing that I do, and they all have their unique skills, and I'm friends with most of them. But the fact is that people find us here because, one, we work hard at some of the marketing things that Kevin Christie and some of the others are going to talk about. We're ethical treatment planners, like Mark King is going to talk about. And then we're highly skilled. Like, we really know what we're doing, and people can feel a difference. And if you can make somebody feel a difference, then they're going to buy into anything else that you do from a rehab perspective or from an advice perspective or from a nutritional perspective. But if you don't make a patient feel different, they're going to have a really hard time buying into complex exercises and complex treatment plans and complex nutritional plans. So I think a big part of skill development is just having a routine and being repetitive with it and being consistent with it. And the more you do this, the more the tumblers kind of fall into place, and Neo sees the matrix, and things start to make sense, because it's not until you do a few hundred of these that you're like, oh wow, this is a lot more complicated than I thought it was. And don't just go through the motions, but kind of go through this with an intent to actually figure out what you're doing. And I think that'll make palpation a lot easier, which makes adjusting a ton easier. So exponentially easier. If you know which direction, which planar motions isn't moving correctly, then you put the unmoving segment, the restricted segment, in a position that's going to help that motion, extension, lateral bending, rotation, and then you add an impulse and things become a lot easier. So I'm going to run through this. This is something that's very reproducible. It's out there. You guys probably can find our YouTube channels and things like that. But this is kind of a system for palpation. And it's going to incorporate 2 or 3 different palpations. All of those palpations should tell you the same thing. And this just helps you with your skill development. So your patient would come in, sit down. If you have a different setup, then you can probably figure out a way to make this work, but we go by position. So we start seated. So Ryan, who's soon to be one of our esteemed colleagues out there, he would come in, sit down. I don't really take much of a history. I don't really ask them what they're doing, how they're doing, because 1, I don't care, and 2, I don't want it to bias my findings when I go through this palpation system. The I don't care thing is a joke. It's really hard to get across on you. So we sit them down, we go through our 6 points of the pelvis. So we scan sagittal plane sacroiliac joint. So my right hand is over the SI joint through the femur or inside the femur. We laterally flex away and we check the frontal plane of the sacroiliac joint. So both of those should tell us the same thing. his springs nicely. We should feel a nice little pushback underneath our hand. Then we go to the sacrum, lumbosacral junction, L4, 5, S1, that whole group. We lean them back into extension, try to get as close to end range, joint play straight through the sternum. From here, we counternutate or have them slouch, do a posterior pelvic tilt. I hook the sacrum or use a flat hand on the sacrum and try to spring the sacrum into counternutation or flexion. Left SI joint straight ahead through the femur. Frontal plane, left SI joint through the pocket. Those are 6 points of the pelvis. Right SI joint sagittal, right SI joint frontal. Extension of the lumbosacral junction, flexion of the lumbosacral junction. Left SI frontal or sagittal, left SI joint frontal. Then we scan the spine. So neutral, stabilizing, or guide arm. We try to get end range and just make note mentally of where we feel restriction. Because Ryan's been working here, he's probably getting adjusted a ton. He doesn't have a ton of restrictions, but if I find one, I typically stop and say, oh, Miss Jones, that's really stiff. Can you feel that? Hopefully they say yes. You know, if they can feel it, then they can feel the same thing you can feel. They know they're in the right place. You want to get them out of that left brain critical thinking and into the right brain. Hey, I can feel a difference. I know I'm in the right spot. And that's really important. And Dr. Fay's talked about this in the MPI world for a long time, is that if you can get them out of that critical thinking, what's wrong with me, and into the right brain, he's feeling the same thing I'm feeling, then the confidence between the practitioner and the patient goes up exponentially. And so you start to build that just through your palpation skills. And again, like the easy part is adjusting, the hard part is palpation. So if we can make this easier for you, then your adjusting gets that much easier. And that skill with your hands is just kind of off the charts. And so now they'll buy into doing 35 press-ups or doing a DNX exercise or something like that.